When people think of children's oral health, I think they traditionally assume that means twice annual visits to the dentist. When we're talking about oral health at the Children's Dental Health Project, we really mean preventing the disease before it begins.
I think there's a lot of negative associations with going to the dentist, partly because untreated problems really do cause pain, and solving those problems also involves some pain.
Untreated dental cavities can lead to a tremendous amount of pain and suffering for kids. Children have problems with their self-esteem going forward. They can suffer health effects that can be both short-term and long-term.
Consequential to their ability to eat, their ability to sleep, their ability to play nicely with others, their ability to tend to their learning. These are significant problems that could be well addressed, but need to be addressed at every level, from public policy to the provision of dental services.
The Children's Dental Health Project is an organization based in Washington, D.C. that is dedicated to representing the unique needs of children with respect to oral health. They're the only organization dedicated to that cause.
It's a long way sometimes from Capitol Hill to the parents and the children, but with that effort, we make it possible for things to happen on the ground everywhere by using the levers of the federal government and state government from here in D.C.
What this project does is open the door for them to get the screening, get the care that they need, so that we can avoid illness, avoid pain, and sadly, in the case of Diamante Driver, avoid death.
They help ensure that we have the workforce that we're going to need for the future. They help us in ensuring that we have funding for educational programs that we have for our residents. They are the ones that chase after those dollars to help ensure that clinics like ours at Children's National are healthy and strong to deliver the kind of health care that we do.
We're concerned with oral health in its totality. That is, the ability of children to grow and develop normally, to achieve their milestones of dental development as well as overall development.
It's just an accident of history that we separate oral health from a child's overall health.
The Children's Dental Health Project has been phenomenally successful in its very short history. In less than 12 years, it has put children's oral health as an essential public health goal on the map, both in Washington and across the states.
One of the most important contributions they've made is building the evidence base on what contributes to good oral health for children in this country and how public policies can contribute to better oral health for children.
The signature accomplishment to date for the Children's Dental Health Project is the passage and signing in 2009 by President Obama of the Child Health Insurance Bill. That bill, unlike its predecessor in 1997, contains 8 specific dental provisions that will markedly improve the opportunity for children to obtain and maintain oral health, as well as to obtain and maintain dental care.
Qualified health care centers, which are located in many of our communities, can now contract out for dental services for kids. Very, very significant.
We've seen an increase in access to care. So I think about 10 years ago, it was about 25% of kids that were enrolled with Medicaid programs that were seeing dentists routinely, and we've increased that to about 33%.
That's a terrific increase, but it still means that 2/3 of the children still don't access dental services in a year. So there are clearly some fundamental structural problems that need to be addressed through the policymaking process.
We have been able to convince members of Congress, staff, policymakers across the country that oral health is consequential. I don't know of many organizations in Washington who are as lean as CDHP that have been able to accomplish the things that they've been able to accomplish.
I think the opportunity to grow the pie, to increase the numbers of children who actually access dental service, utilize dental supplies, engage dentists in their work, the opportunity to provide better health at a cost-efficient way, and to improve the oral health of children itself is one that is worthy of significant support.